by the Uganda Union Mission to serve the communities around Bugema. It has been undergoing transformation from Center 2 to Center 3, now Center 4. But our desired status is a hospital. By so doing, we are implementing a government program of facilitating, equipping lower level centers to offer comprehensive services and as well as specialist services to the communities. By so doing, this is a strategy to decongest the national referral and the regional referrals in the different places. So taking charge, taking lead in the upgrading of this facility to a hospital, we are trying to implement a government program. How we are doing it, one of the strategies, we are doing partnerships. And what we are doing here is part of our partnerships that we are doing. We partner with some hospitals in Germany that have been doing very well in the field of lymphology. And lymphology in Uganda is not anywhere. So through our partnerships, now we are offering lymphedema surgical and rehabilitation services in Bugema, in Uganda, and in Africa. We began this in February this year. We operated on 4 patients. 3 were done from here. The first surgery of this kind was done from Mulago because the patient had severe lymphedema stage 3. So our facilities were kinda limited to support the patient in the surgery. And then the other 3, still the first of its kind in Africa, were done from Bugema. And again, we are doing similar services, unique of its kind, still in Bugema. And this time around, we are doing it in 3 hospitals. Remember, like I mentioned in the very beginning, we aren't working in isolation. We are working with government hospitals. So we are doing some surgeries here in Bugema University, and then others will be done from Mulago, National Referral. Then others, because our main focus is to bring services near to the people, those who are coming from Western, we are going to do surgeries from LUKULA General Hospital, it's a government hospital. Lymphology as a field is very new, and when we've been advertising, making awareness on TV, people have been asking, what is that special thing that you do about lymphedema? So here you've seen, and it's going to be like this. We intend to expand to more than 28 host facilities in Uganda, but of course working hand in hand with our partners.
Yes. Now I'm told that some of the surgeries are going to take place here. Are they going to be done by foreign surgeons, or your surgeons that you have here at the hospital have been trained to do so?
The surgeries that are going to be done, remember we are developing a service, and you see in the field of medicine and surgery, it's like carpentry. We do learn by apprentice. So we are the lead surgeons normally come from Germany, and they are the leaders. They are the lead surgeons in this. So our surgeons are part in the surgeries, but the lead surgeons come from Germany. Reason, they have been doing it over and over, so they have the technical know-how of doing these surgeries. Because one surgery, for example, patients that are found with the blocked lymph nodes, normally they qualify for a surgical procedure called lymph node transplant, lymph node transplant and anastomosis, where lymph nodes are gotten from another part of the body and are transplanted where those blocked ones are. And this is a surgery that takes between 8 hours to 12 hours. So in a day, normally we work on 1 or 2 patients. But because we are trying to demonstrate to the world, to Africa, to Uganda, that this service can be done in Uganda, we normally limit the number of surgeries we do. We shall operate a few patients time around. In February there were 4. We are praying that, God willing, we can be able to at least serve 10. Then these others are going to, like you have seen, they've already started going through non-operative management of lymphedema. That involves compression therapy, where there is bandaging, manual massage, electric massage. All this is we are trying to reverse the pathology where the lymphatics are unable to drain the limbs. So by doing this, we are trying to bring back the functional physiology of the lymphatic system of these affected limbs to begin functioning as they were before. Yes.
Okay. So what's your expectation? Of course, it's exciting that out of all the health facilities, a starting health facility is at the lead of this.
We expect, actually, my dream and our dream in Bugema is we want to be known in Africa for at least something unique, and that is lymphedema management. When we progress very well, we are going to expand. Ministry of Health, Uganda Medical and Dental Council will start doing short courses for all the doctors in Uganda, either Zoom or weekend program, because we want, you see, why our people normally their conditions worsen, they normally begin small by small, but because of misdiagnosis, failed diagnosis, lack of care, these conditions worsen because patients, they try to seek care, but like you've listened to many of them, when they go to facilities, they're told your condition, there's not much we can do, go back home. So this leaves a gap, and we are saying, for us as Bugema plus our German friends, we want to work hand in hand with Ministry of Health, Uganda Medical and Dental Council, to train all primary care caregivers, that is nurses in health center 2s, health center 3s, health center 4s, clinical officers, health center 2s, health center 3s, health center 4s, medical officers, general hospitals, general referral hospitals, so that services can be holistic. You may go for malaria, but if they find that there's something wrong or developing in your limb, whichever health worker is handling you will be in position to identify that we need to do diagnostic tests to see, is this lymphedema, cancer, or something else, so that this patient can be able to access health services in time, so that the complications of lymphedema do not take course in this patient. At the end of the day, we shall see an increased reduction in the number of cases of lymphedema. You may not have gotten a chance to see some of our patients. There are those teenagers from S4, S2. Children are dropping out of school as a result of lymphedema. Once it starts in school, the school nurse doesn't know what to do. When they go to maybe a nearby health facility,
You know what to do.
you get it. So we picked interest in this. Yes.
Okay. I'd like to thank you so much for your time and for sharing with us.
You're welcome.
And we